Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight, are you a cancer survivor? We're going to talk about why and some new treatments that are available. Do you have gastrointestinal complaints? Well, you might need a colonoscopy because it's not only for screening for colon cancer. And have you had a lab test? Well, what happens to the blood once it leaves your arm? We're going out to the laboratory to find out. That and Feed is here to help us with hungry kids. Tonight, to start us off, is Dr. Amie Jackson, who is an oncologist with Baptist Health. Welcome.
Thank you. Thanks for having me.
Well, I'm going to start you off with a graphic. It's national trends in cancer death rates. And the graphic is kind of busy. There's a lot of stuff on there. But the trend is the blue part of the graph there shows decreasing cancer rates. Does that mean more people are surviving? Is the diagnosis better? Is cancer just going away?
Yeah.
Give us some idea.
Sure, those are all great questions. So, what we're seeing in the last 20 years is some cancers where there's decreasing incidence, but a lot of cancers where there's been efforts to increase early detection, but also improvements in therapies, and those are translating into patients living longer and better with cancer. So, for example, the bottom of the graph there shows melanoma and lung cancer, and that's where we've really made the most impact in the last 20 years in terms of continuing to decrease the mortality rates from those cancers.
Is it treatment, diagnosis? Why do you think that occurs?
Sure. Well, for the longest time, sort of prior to the year 2000, really all we had in terms of treatments for advanced cancers was chemotherapy. But the treatments have come a long way, and so in the last 10 years especially, there's been a lot of improvements in terms of more targeted therapies available. So for melanoma that's listed there, we saw in around 2010 the first immunotherapies that became commercially available. So these are drugs that help your immune system fight the cancer instead of just relying purely on chemotherapy. For lung cancers, there's been development of a lot of targeted therapies. So what's sort of making the cancer tick for one specific person's lung cancer, and do we have a pill that can alter that process and sort of interrupt that process from happening? So that's been a huge sort of area of development, is just trying to get better treatments out there. But there's also been a lot of efforts in terms of improving early detection. So just like you get your mammogram and your colonoscopy, there are efforts in place to kind of get the word out that patients who have a history of smoking, who are above the age of 50, should be getting screening lung CTs to try to detect lung cancer earlier. So, part of it is early detection, part of it is better treatments, and then of course it starts with, trying to introduce those lifestyle modifications to prevent the cancer from happening in the first time.
Now you mentioned treatments, and we're hearing a lot about genetics. Do they treat cancer by genetic modification, or doing any research to that, or is that just?
Yeah, that's a great question. So there are certain cancers that we know of that have a genetic predisposition, and so the BRCA mutation, which is associated with an increased risk for breast cancer, prostate cancer, and ovarian cancer, is a good example of that. And in the past, we've tried to screen for those mutations in patients with those cancers so that we could inform their family. But now there are actually treatment options that disrupt sort of the process that happens when you have a BRCA mutation, and that can be used as a treatment for those cancers now. So it is a landscape that's very early in development, but certainly a potential target for at least some patients with cancer.
Well, now there's a lot of cancers out there, and it just sometimes I say sometimes like managing chronic disease. You have hypertension, you have diabetes, and we manage that. Well, some people just have cancer and you manage it. You live your life by managing your cancer. Is that the case?
Yeah, there certainly, when a person's diagnosed with cancer, cure is our ultimate goal for many of those patients diagnosed with an early stage cancer. But I think a lot of the improvements that we're seeing in some of those mortality rates are from people with advanced cancers who we really didn't have effective therapies historically quickly, but more and more drugs have been developed to try to, keep them alive, but keep them living longer and better with good quality of life for as long as possible.
That's great information. We appreciate you coming in.
Thank you for having me.
Make sure you get your cancer screenings so you can be one of those cancer survivors. We'll be right back.